most of the time there aren't actually that many early symptoms of liver cancer. And the reason why is that the liver itself is a very big organ. And when the cancer is starting to grow, it doesn't actually affect any part of your body that would cause a symptom. So it's actually very hard to actually experience symptoms. What we normally do see by chance is that patients' liver function blood tests become abnormal. And that's normally the best early sign that we have of liver cancer. And actually, most patients who have liver cancer have what we call underlying cirrhosis, so scarring of the liver. And they normally have quite regular scanning. And those patients, when they have those regular scans, will normally have small tumors picked up. 90% of liver cancer patients are normally diagnosed at the early stage setting. That's because they have what we call cirrhosis. So this is scarring of the liver. And in the UK, at least, we're very good at following up these patients and doing regular scans where early tumors may be picked up. In other patients, they may not get picked up as early, and we may not know that they have underlying scarring. So they would get picked up normally when they've displayed symptoms such as weight loss or jaundice. So the field of liver cancer treatment, we actually have several treatment options actually, which is excellent. So with early stage liver cancer, there are several options. So because the patients have underlying cirrhosis, the only cure that we have for most patients is to do a liver transplant, which only certain patients would fit under, and that's to remove all the scarring and give them a new healthy liver. But actually, with the early stage treatment options, this could actually keep patients disease stable for several years. So options that we have are surgery, ablation, a new treatment called SIRT, which is giving radiotherapy beads. We also have TACE or TAE, which is embolizing a liver artery to starve them of oxygen and potentially giving them chemotherapy as well. So as you can see, there's a few options for early stage cancer. But when the cancer becomes more advanced, oh, sorry, I need to include ablation in that as well. But when the cancer becomes more advanced, we could actually offer systemic treatments. And with that already, we've got several options, including immunotherapy and targeted agents. So the risk factors for liver cancer are all based around what causes cirrhosis, which is the scarring of the liver. And the commonest causes would be viral hepatitis B or C, drinking excess alcohol, having a immune-mediated disease that would attack the liver. But actually, the commonest cause in the UK is actually being overweight or obese, which could actually cause scarring of the liver. If we could transplant someone's liver when they have liver cancer, we could actually cure them. But if we can't do that, actually, because we're normally catching these patients quite early, we could actually get patients living for quite a while, especially once they've exhausted all the early stage and late stage options. And I would put that prognosis for actually several years for most patients.